Now, you asked me connections of teeth. Your first 4 front teeth here and here are on your urogenital line. That means it goes down to your urinary tract, your sex organs, and your peer. I have had patients come in. The problem was one guy was impotent. He had been married 18 months and nobody could figure anything out. He had been in a baseball accident. He knocked out a few teeth. He had root canals down here and another one over here. And it happened to be his wife that knocked him out, by the way, before they were married. Oh. And so she is devastated. They're 18 months in their marriage and he can't get an erection.
Oh my gosh.
So I sat there and I said, okay, let's use the acupuncture trigger point injections and we'll see if that does anything. So you know the Valley. He lived in Sun City West, came to see me, and I did acupuncture along here. And I said, here's my phone number, give me a call. And the next morning while I'm in the shower, the phone rings. I finished my shower. I go ahead, I take the thing, and there's a voicemail. And it was him. He says, Dr. Margolis, my wife has one thing to say to you. And so he handed her the phone, and she goes, whoopee, and hangs up the phone. They had their first child 10 months later.
No, they didn't.
But he didn't come to me to get the work done. He went to somebody else to have the teeth extracted. And he was wearing a partial, which was metal-based. And he became impotent again.
Oh, no.
And he called me up and told me I was mean and cruel and everything else. I said, what did I do wrong? He says, well, I can't afford you. And I said, well, I'm sorry. But what's the problem? And he says, well, we had a baby. I wanted you to know that. And I credit you for that. I said, I didn't touch her. Please. And second, after that, he just disappeared. I don't know whatever happened. It's heartbreaking because, you know, if people have a hardship, talk to me. But it's my fault. So anyway, that's just one. So your canine teeth are going to be your liver and your gallbladder,
okay,
as will be your upper premolars and lower molars are going to be your lungs and large intestine, and your back molars and premolars are going to be your stomach, your thyroid, parathyroid. And that's how I got into this. And I'll tell you that in 1 second. Yeah. Your wisdom teeth is going to be your circulation, your heart, and your duodenum, jejunum, your small intestine. I had a root canal done many, many years ago. And I was involved in a car accident. So it's this tooth number 3. If you can see it, It's not there.
Yeah.
Everybody says, why don't you put an implant in? Why don't you get a bridge? Why don't you do this? I can't tell my story.
Okay. I lose my prop.
I don't have my prop, and all I got to do is go, all right, here it is. So within 5 days, the car accident, I was waiting to make a left-hand turn, and a tow truck hit me at 45 miles an hour. I had no idea I was going to get hit. I got a torn rotator cuff in here. That's as far as this arm will go, because I pulled the car from oncoming traffic. Anyway, one guy came back to see if we were all right, and he peed in his pants because he said, if you didn't pull that car the way you did, you would have been hit head on by mine. And so, long story short, my neck went from 17.5 inches to 24 inches. 5 days. I was misdiagnosed with thyroid cancer. My ex-wife insisted that I get the surgery. I said, let's wait 6 months. And the doctor told me, oh, you wait 6 months, you could be dead from thyroid cancer. Thyroid cancer is one of the slowest cancers in the body.
My wife had it, yeah.
Yeah, and it's not something that's going to kill you in 2 months.
Right.
And I said, let's check it in 2 months. Now, I had to do it. I finally went ahead and did it. And the biopsy showed it was totally perfect. It was totally normal. Then I became a diabetic. Then I started searching. I started searching for answers. How could this cause me to get sick? And then the capper was kidney stones. First time in my life, I had kidney stones. these teeth connect to your kidneys. So if you take a look at Dawn Ewing's book, Let the Tooth Be Known, she goes through the entire chart, tooth by tooth. So you could learn exactly what it is. Or you could go to my website, mydentistaz.com, and we have an interactive chart. We're rebuilding it, so sometimes it doesn't work, sometimes it does, but we'll get it there. And you can see what tooth is connected where.
I'll put the link in for you guys on this so that you guys can find it, but that'll be another one. Look in the description. But go ahead, please.
Yeah. So, yes, the body is connected. I cannot tell you the hundreds of patients that I've cleaned out past extraction sites called third molars, and how many were on blood pressure medicine. And once we clean that out, I never tell a patient, get off your blood pressure medicine. That's not my position.
Right.
But they would go in and get re-examined, and the doctor says, what did you do to your blood? How did this? You don't need that much medicine. In fact, I don't think you need any. And he said, what did you do? He says, I saw my dentist.